What about Gregory?
When you see one child with autism, they're also different. But what we mainly focus on is they're training them into how to basically behave, and because they have a lot of issues, sensory issues. So we focus on pre-academic skills. We do speech therapy. We work on their sensory skills. We work on their life skills. We work on speech, some kind of language skills, teaching them. And we work on just basic daily living and how they will manage and become useful to the society or reach their highest possible potential. So basically this is what we do at the center. Firstly, my son has autism. He's now 31 years old. I used to live in America with him, and then on my return I just wanted to find like-minded people like me and my son, so that we could just talk about our issues, chew the fat, and take care of ourselves. And I'm looking at this boy, and they're telling me I shouldn't expect this and I shouldn't expect that. It's like, oh, your child is going to be mentally retarded for the rest of his life, and they just let you go. Autism is scary from a mother's point of view, but basically it's a neurodevelopmental disorder, meaning it's not a mental disorder. And it affects the way, particularly in the area of language and communication, and it affects the way a person socializes with the outside world, like interact with other people. And most children with autism don't have imagination, so it's like we have to teach them and constantly help the families also learn how to handle the children with autism. So it's not easy. If I say, I thank God for Note, my son, yes, autism has been a very arduous journey, but I look at him, look at what he's done in Ghana. Without him having autism, we wouldn't have the autism center. This is the boy, they said he wouldn't be able to do anything. So I tell the parents, they have to find out a lot for themselves. Read as much as they can, if they can read. Of course, there are people who cannot read. Do a lot of counseling. Acceptance is difficult, but they must come to that level of acceptance. Yes, because you can grieve all you want, but when somebody passes away, you grieve and then you move on. Oh, I can proudly say that before the center started, nobody was talking about autism in Ghana.